Now we're going to review how to do an Ovidrel subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies. You'll need your injection, so you can see it here. You also need your alcohol prep pad, and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. At this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Ovidrel trigger injection.